Next, it is my distinct honor to introduce two exceptional medical students, Sanjana Kumar and Love Thakkar. Despite the full demands of being a medical student and their training and stepping away from studying for their step study time to join us, they are co-inventors of Fluoroscreen, an award-winning, groundbreaking test for early detection of colon cancer. As board members, one of our most important roles is serving as ambassadors for the School of Medicine. So stories like theirs will reflect the extraordinary innovation, creativity, and impact emerging from our students, faculty, and researchers. These stories make us very proud, so we like everybody to hear about them. So if you can come up and tell us about your intervention.
Hello, everyone. My name is Love,
Hi, everyone. My name is Sanjana.
and today we're going to be talking about Fluoroscreen, our mission to redefine colon cancer detection in America.
Alrighty. Well, first, we just wanted to give a little background about ourselves. It's nice to be here with you all and nice to meet you all. My name is Sanjana. I'm currently the product lead for Fluoroscreen. I'm also an M2, so class of 2028. I graduated from the University of Michigan in April 2023. And prior to that, I did a Fulbright after graduating prior to starting medical school. And I did a Fulbright in Sri Lanka for 11 months where I was working on research on diabetic retinopathy and just improving access to retinopathy screening, which is kind of partially some of the inspiration between wanting to improve access to screening for colorectal cancer with this initiative. And yeah, so that's kind of part of what inspired this. I also have an interest in ophthalmology, so that's where I'm hoping to go in the future.
Yeah, and I'm also a part of the second year class of 2028. Before coming to Wayne State, I graduated from Nova Southeastern University in South Florida with a degree in public health. And I'm originally from New Jersey. After medical school, my current interest is in the field of general surgery. And at Fluoroscreen, I'm working on business development. So to talk a little bit about where Fluoroscreen really started and what me and Sanjana were thinking about when we developed this idea initially, one of the things we noticed in our clinical experiences, and I'm sure all of your own clinical experiences, is that the screening requirements or screening recommendations for colon cancer can be quite cumbersome and hard to approach for a lot of people. The colonoscopy being a surgical procedure, stool collection could be a thing someone's doing for the first time and is not immediately comfortable with it. And the current data says that 1 in 3 people are behind on their colon cancer screening, meaning as per the recommendations, 1 in 3 people are behind on their annual or every 10-year colonoscopy. And this is where our idea kind of came about, that a lot of people are missing out on these screenings, and we're hearing of stories directly from patients in the clinical setting that, my mother told me she was getting a colonoscopy for the past 45 to 75, and today she got colon cancer. And I found out that she was lying to me the entire time because she was so afraid that she never was able to go in and actually do it. And those kind of stories kind of stuck with us as we developed Fluoroscreen. And so I'm just going to talk about what our product actually is.
Yeah, so now we're going to talk a little bit about the tech and IP side, so how the product actually works without getting too much into the nitty-gritty of the molecular stuff. So Fluoroscreen is essentially an injectable protein. So it's a recombinant patented protein that we've created. And essentially, we wanted to walk you through how it would work from when the patient is first injected with the protein to what it would look like being detected in the urine eventually. So the patient would come into the clinic, whether if they know that they need to get colon cancer screening done, it can be injected like in the waiting room while they're waiting, or even after the visit. It just takes 30 minutes to detect. So after they're injected, essentially the protein will go through the patient's body, bind to any potential colorectal cancer cell markers that we've identified and are choosing to work with for the protein. And then upon binding, the protein actually breaks off and releases a fluorophore, which goes through the patient's body, is filtered by the kidneys, and can be detected in the urine within as little as 30 minutes. And so I'm sure you can all imagine like a patient who's already scared of getting a colonoscopy or uncomfortable with doing a stool sample would probably be a lot more comfortable doing something that's more comparable to, say, a flu shot, just an intramuscular injection, rather than having to take off work, go through anesthetic and do like an entire procedure, have to have family who can drive them home. This is a much more not only cost effective, but also just more accessible way for them to be able to get that done. So we just wanted to touch briefly on kind of what's already out there and why what we're working on is better. So like we mentioned, the traditional colonoscopy is obviously very invasive. No one really wants to ever get that done. Takes a lot of preparation work. It does have risk of complications. Sure, you can detect precancerous lesions earlier and get them removed during the procedure, but Fluoroscreen does also aim to improve the accuracy of precancerous detection. So that advantage of colonoscopy can also be attained with Fluoroscreen. Aside from that, there's also FIT testing and stool DNA tests, which, yes, are non-invasive, but the trade-off there is you do give up that early precancerous detection. And sure, there are low risk of complications, but it's not that cost-friendly. Patients still aren't comfortable to put their stool in a bag and send it off. And also the results take a long time to come back. So Fluoroscreen, our solution here is to put together all of those advantages that we see having to trade off between the existing solutions and create a solution which allows patients to feel comfortable and confident in the results that they're receiving within 30 minutes.
And now we want to talk a little bit about what Fluoroscreen has done so far in our progress. So first big step was actually began right here at Wayne State. The Mike Ilitch School of Business hosted a startup competition open to the entire school. And Fluoroscreen was glad to receive first place in that competition and receive a $10,000 grant. Right after that, we were able to continue that momentum with Techtown Detroit, which is a great partner and affiliate of Wayne State, and Venture 313. They're also able to grant us a $15,000 non-dilutive grant. And then a little bit more recently, in September 2025, Fluoroscreen was announced out of 600 applicants as one of the City of Detroit's inaugural Startup Fund awardees, the seed grant of $15,000. And what that really enabled us to do was two very important things. We were able to protect our idea and knowledge and filed the provisional patent application that Sanjana mentioned. And then we also initiated our pilot study. So right now, we interviewed a lot of CROs, and a company in Long Island, New York, Perfection, is currently, we've assembled our novel protein, and then we're testing it on cancer cells as you speak right now. And extremely recently, actually, 2 weeks ago, and everyone here will be the first to hear about it. It's not truly announced. They told us not to announce it, but the City of Detroit also selected us for the Detroit Tech Founder Fellowship. So we're one of 8 awardees with a $30,000 grant from the City of Detroit as well for that. So it's just a little bit of good news that we wanted to share with you guys. Thank you. And looking forward to the future, I think there's a ton of potential. Just the way our molecule is designed and the molecular biology of it, we hope to expand to over 20 cancer types and move beyond colon cancer, which is our current initial focus. Of course, we're thinking about implementing artificial intelligence to build cancer risk profiles based on the fluorescence detection in the urine, which would give an idea of, through the metabolites excreted, what's going on within the body. And most importantly, our goal is also to improve screening in marginalized populations, which universally, not just colon cancer, screening rates are lower in. And we think that by creating an accessible option with the minimal overhead and quicker detection, we think we can make a lot of groundwork on that. That's just, yeah, really thank everyone for listening. Yeah.
So patient. Oh, sorry. So amazing. I don't know how you find time for that. It's crazy. Patient comes in, gets an injection. I'm thinking of fluorescein angiogram, right? Ophthalmology fluorescein. Then they excrete it in their urine, and then what is there, there's a machine, how do you detect in the urine what's happening?
Yeah, so our goal is to use photospectrometry to detect the wavelength of the fluorescence from the urine, which would align with the fluorophore that's ejected upon cancer binding. So that's was our initial thought. Right now we're in the research phase, so we're still modulating what that'll look like or what the actual fluorescence that's eluted looks like, but that's our aim as of right now.
So that sample would go off to like a lab?
Ideally, it would be available on site as to be able to be read fluorescence.
So can we book you, both of you, to the first annual research seminar that we started actually last year as 4 thematic research areas, one every quarter. And in April of this year, they're going to coordinate the top topics to be presented to mostly researchers, but also, well, many of the clinicians also. So if we send you the date and we give you some time to pique more interest for our researchers, let us know. Dan, you know how I will get hold of my students. Okay, so please keep that in mind. Thank you.
Absolutely. Thank you, Dean Soccer.
I've been using fluorochromes in detection of DNA for histocompatibility since, and basically when Dr. Skopp invented the tool, we were one of the first labs at Wayne State University here to use that for actually doing HLA typing. So the concept is really, really good. I love it. Now, here's the question. What do you do for somebody who's got renal failure?
That is an amazing question. So that's me and Sanjana have been talking about that a lot because we know that's one of the comorbidities or documented comorbidities of colon cancer. So the only way we would proceed with that is to collect enough data to understand what's happening to the fluorescence as kidney function declines. That's what I was a little bit talking about by building cancer risk profiles, because once we get more data, we can kind of build a model to understand what fluorescence means with actual cancer diagnoses. But that's a great point, and that's something that we've been talking about a lot offline.
Yeah, and we're also kind of to that point, we're working with a bunch of different types of fluorophores just because we know like variations in size and things like that can also just change the way that it's eluted through the kidneys. So that's also something that we're working on. And like Love said, we're hoping to be able to use eventually a broad range of different fluorophores with different sizes that maybe smaller or larger could be eluted through the kidneys or, easier, depending on whether the patient has renal issues. Yeah, that is true. Like, I think because our like initial idea was wanting to make it more accessible, we thought urine would be like an easier way for patients to just give like a urine sample. But that's a great idea because our fluorophore is cleaved in the bloodstream. So essentially within 30 minutes, it would serve the same function to just take a blood sample. So yeah.
Sort of along those same lines, do you guys have any kind of built-in positive control that shows that the test was successful and adequate? So that way, you know, if there's nothing in the urine, there's actually nothing. It's not just a failure of the test.
Yeah, absolutely. So right now, the way we're testing it is we're also building a probe that's uncleavable and also at the same time administering that probe. So we have a control, and that's how we're evaluating our data against.
I'm curious, did you start as an M1 with a research lab PhD, or how are you doing all of this? I'm just curious with all your studies, and there has to be a lab and somebody you're working with.
Yeah, unfortunately, right now we actually are not affiliated with like a PI or a lab. A lot of our like, I guess support has been more on like the business and tech side because that's what I think both of us are a little more unfamiliar with. But we are open to hopefully looking for a faculty mentor soon, someone who could help guide us a little bit. We have been talking to, I guess, doing like customer discovery with other general surgeons and people who are administering colonoscopies, but we don't have any formal mentor or faculty mentor right now. So, yeah.
So
Hi.
it's kind of more business off.
Yeah, it's more off. A lot of our support has been more like through Tech Town or offsite like business
Separate
mentors.
vendors.
Mhm,
Okay.
yeah, yeah.
It's a question in the chat. Hi, it's Erlene Seymour. I'm an oncologist. Do you have an advisor who's a colon cancer or GI oncologist? I think that would be like really helpful for you guys because even thinking forward, like I'm also in pharma now, but it's almost like you guys have a really great concept, but you also have to think about real world implications and how this will be used if it works. Like,
Mhm.
for instance, if it's positive, what next? Do they get a colonoscopy anyways? Because they'll need a biopsy. What happens if they don't find anything? So it'd be good to get an oncologist early on as an advisor.
That's definitely a great suggestion. We're definitely hoping to find a faculty mentor who would be able to help us, especially with some of the more clinical sides. So that would be definitely something we have on our radar and next steps for sure.
There's fabulous folks at Carmanos, just putting that in there. Dr. Shields, Dr. Najib Al-Halak, they're really great.
Thank you so much. Yeah, we'll definitely reach out maybe to some faculty mentors at Carmanos. Yeah. Love's favorite show is actually Shark Tank. He watches it
Yeah.
like every day, basically.
show.
Yeah.
Good stuff. Yeah.
I think any faculty mentor will be lucky to get you, so.
Thank you so much.
Any more questions? I have to go back and study for that.